that's causing this experience to happen pretty much as a hallucination, but the trigger is some sort of chemical event that leads to a hallucination. The other was that this may be some sort of psychological process. Maybe people who think they're about to die are comforting themselves through this process. So it's kind of a reaction to the knowledge that you're about to die, and they start to have this very complex imagery to comfort themselves through that, i.e. typical near-death experience. And this is the majority viewpoint. There were some who proposed this, and fewer who proposed a transcendental theory, which is that, well, maybe, or spiritualism, whatever you want to call it, but maybe, this is in the medical literature, maybe when people claim that they're out of body, they really are out of body and they're able to see themselves, and this suggests some kind of separation of their mind or consciousness, whatever you want to call it, from their body. This age-old philosophical question of, what is the mind, what is the body, how do they relate to each other? So these were the three kind of categories of views that were expressed in the literature before I got involved with my research. And then a few years later I found another theory which thankfully didn't catch on, but was interesting, which was this: that maybe a group of very interesting, evil-looking surgeons come late at night when you're about to have your surgery and the lights are all out, shine a bright light into your eyes, and then 6 months later you appear on Oprah. And you're telling them, and then suddenly I saw this bright light at the end of the tunnel. I only saw reference to this in French et al. 2002, was it? No? So this is a fourth theory, which Chris did not propose, by the way. But I thought was very interesting. So I haven't seen that myself. Maybe that's what we do late at night in hospitals. I haven't done it myself. Maybe we should for fun and see what happens. So the question is, that was basically the background. Now, for me and my perspective very much is, how do we study this? And for me, I'm not that interested in near-death. I have to be honest with you. I mean, it's interesting. I think we've learned a lot about it, but near-death is very vague, and I'll explain why. And for my field, I deal with people who die, and I want to bring them back to life again. And I think that what I'm interested in really is what happens to people when they die, which is a cardiac arrest. And for those of you who don't know, and most people don't know this, I just want to clarify a particular point here. Most people, and I know this from my experience of working with the media, I explain things to them and then they write it up and I'm like, where did you get this from? And I realize there's a little perceptual. I don't think it's on purpose, it really is. Most people think, in fact, let me ask you, do you think a cardiac arrest is the same as a heart attack? You don't feel shy, the way I asked you. Do you think it's the same thing, a cardiac arrest? How many, just so I know, would you put your hands up? I never asked this in an audience, but put your hands up if you think, before today, you thought cardiac arrest and heart attack are the same thing. Interesting, at least half, if not more. Okay, good. So that's what the media always writes, so I'm like, a cardiac arrest is not a heart attack, just so you know. A cardiac arrest is death. It's the same thing. It's exactly the same thing. It's two different terms for the same thing. The reason I say that is a cardiac arrest is when your heart stops. Now your heart could stop for many different reasons. I could go out and be hit by a lorry. I hemorrhage, okay, and because I'm hemorrhaging, my heart eventually stops beating. There's not enough blood around to make it pump. I could have severe infection, like meningitis, let's say, severe infection, which causes my brain to get disease, and the rest of my body eventually causes my heart to stop. Where I could be ridden with cancer, whatever process it may be, eventually it leads to the heart stopping. One of the things that can cause a heart to stop, if it's bad enough, is a heart attack. A heart attack simply means that the blood, which needs oxygen and nutrients, one of the blood vessels, or more, gets blocked with a clot. And because it's blocked, there's no blood flowing into the heart, and the heart therefore stops beating, if it's bad enough. Of course, most people who have a heart attack don't die of it, they just get very ill and then they recover. But if the clot is big enough, it can cause that to happen. So the point is, many things can cause the heart to stop, one of which is a heart attack. But the key thing to remember that the way we define death today, medically speaking, is essentially when your heart stops beating. So when we diagnose, if I get called to diagnose someone as dead, certified that they're dead, I look for three things. One, that they have no heartbeat, i.e. cardiac arrest. When the heart stops beating, consequently, because there's no blood flowing anywhere else, all your organs stop functioning because they need blood flow. So you stop breathing within seconds, and your brain also stops functioning within seconds as well. So what we look for is that they have no heartbeat, there are no respirations, no breaths, and then we shine a light in the pupils you've seen on TV, and if your pupils are fixed and dilated, that tells you the brain stem, which keeps you alive, has stopped functioning, and that's how we define death. And this happens, just so you know, it's not like a thing that takes a long time. Your heart stops, everything else stops within a matter of a few seconds, because they're all dependent on blood flow. So that's death. Now, that's death. Now, if I then jump on the person and do chest compressions and say, help, help, get the cardiac arrest team here, let's give adrenaline and this, we call that cardiac arrest because we're still managing it. We're trying to reverse that process of death. If we say this person had a recommendation not to be resuscitated, then we say he's dead. And when we stop resuscitation attempts, we say he's dead. But it's basically the same thing. Do you see, that's the biology of death. And that's a key thing to appreciate. So for me, it's important to study what people experience during cardiac arrest, because that's when they're biologically going through death. It's not near death. It's not, he was a bit of this and a bit of that. We have some understanding of what's going on, and I'm interested in that. And the reason why it's also important to study, for me at least, cardiac arrest cases, is because when you say near death, from a scientific perspective, it's very vague. What do you mean by near death? And we see, I'm sure Chris has seen this 100 times, People come along, 50 years ago I was in hospital and the doctor said you were really ill, and then I saw this light. I mean, who knows? How ill was he? Was he really coming to death? And the point also to realize is that when patients come to hospital, for example, Moody's definition, when he published his book, was near death for him was anyone who would have probably died without any medical intervention. But that's pretty much all the patients who come to hospital, then they're going to die, so we should just, right? So people who come to the intensive care unit, of course, if we don't intervene on them, if we don't put a breathing tube, well, they will die. But actually, hopefully, in most cases, they don't even get close to it. Hopefully, we maintain their blood pressure, we maintain their breathing, whether artificially or not. And so it's very vague. And that's, in my opinion, one of the things that leads to a lot of controversy, because people are like, we're debating, talking about apples and oranges, it's very difficult. So for me, I wasn't interested other than just accepting that, there is a phenomena out there. It's too vague. Led to controversy. But what was interesting for me, and I'm not an expert in this, and Chris probably knows a lot more than I do, just scanning through these experiences, they did seem to have some kind of religious type of effect, or mystical. They seemed to have some similarities to deep religious mystical experiences. And interestingly, a lot of people who survived their near-death experiences were really transformed by it. They became more altruistic, less afraid of death, less materialistic, for whatever reason, which has also been seen, I'm sure, in other deep religious experiences. But for me, I'm interested in, again, this is all interesting, but I'm interested in what happens to the human mind at the point of death and during the process of death, which I'll explain a bit more. And so cardiac arrest is the closest thing we have, and I don't even want to call it a model, because it really is death. And the other point that I explained to you earlier, which I think is in the next slide, is that which you don't see here, there is actually a pyramid here, which I don't think it projects. Does it project? Yeah. All different causes ultimately lead, if you're going to die from a heart attack or a traffic accident or cancer or infections or whatever it is, ultimately leads to the point where your heart stops. Now, what I think I said I've evolved myself in my thinking. As a physician with many years of experience, I used to believe very, very emphatically that when you're dead, you're dead. Right? There's nothing here, you can't, don't be stupid, like you're dead. Yeah. Now, I want to ask you a question. How many people believe that there is a moment of death? Like that, you're either dead or you're alive, right? You can't be both. Does everyone believe that? Hands up, please. Hands up, do you believe that? I'm going to put my hand up too, to be brave. Okay. So again, most people, most of us, and most doctors also, who don't deal with this intimately, would believe the same thing, that you're either dead or you're alive. And that's what we say. We're like, he's dead, stop. What I want to tell you today is that as a consequence of research that's going on in this field of whole resuscitating people who died, what's becoming really scary is that we don't even know how to define death anymore. It's very, very difficult. So don't tell this too loud to the outside, but it really is difficult. And the reason for that is this, because I want you to just start to imagine what death really is. Break it down from the philosophical, sort of emotional aspect of our death to a biological thing. When your heart stops, which is when you've died now, right? What's happening inside your body? Well, first thing that's happening is you're getting a lack of blood flow, and consequently, you start to undergo various changes inside the cells that make up your body. The brain cells, your kidney cells, your liver cells, everything starts to undergo changes as a consequence of a lack of blood flow. So this process initially is reversible, because if I die and someone quickly restarts my heart 20 seconds later, well, of course I'm going to be all right. So there is a process by which death is actually reversible. Now, for your knowledge, today's science allows us to deal with death up to over an hour of time, which is reversible, right? There are cases of people who've been dead for 3 or 4 hours who have been revived, especially if they were cold, okay? And there are a number of case reports of people who have actually a phenomenon we call auto-resuscitation, where they spontaneously have had a heartbeat again themselves without any medical intervention a period of time after they had died. Usually minutes, cases of, they claim 30 minutes, but usually shorter than that, but nevertheless there are. Now most of these I don't think get written up, but if you scan through PubMed you will find these case reports. So what's important to realize is that death itself, our concepts that you're either dead or you're alive, are actually not true. Death is a grey process. It's a biological process that begins when your heart stops beating, but actually continues through. So if you follow that trend over minutes, hours, days, weeks, eventually our cells die and then they decompose, and unfortunately it's a bit gruesome, we're left with a skeleton. That is the natural process of death. So why do we think the way we do? Why does society generally think of life and death in such black and white terms? Because if you think about it, go back through the history now, we're not the only people who are interested in reviving the dead. There's a whole history about this, you know. If you look in the old days, I was fascinated to read the history of medicine, you know. Galen, the Greek physician, around AD 200, associated life with heat, which is true. And they thought when you're dead, you're cold. So what they used to do, early physicians, they used to try to warm you up in order to give you life again. So they would use all different kinds of things, the worst of which is putting burning excrement onto the body. So I tell all my colleagues, if you think dealing with a cardiac arrest is messy, think about how it could have been if you were around in Galen's time. That would be your job as an intensive care physician, to put feces on people and hope that they'll warm up. So they would use that, or warm ash or hot water. Later on, they start to try to stimulate you after you die. So they whip you to try to stimulate you back to life again. I don't think they were very successful, but they did try that. So flagellation was another method. And then what was fascinating for me, looking at intensive care, was around 1530s in Europe, people started to use fireplace bellows to push air into the lungs of people who died. And it makes perfect sense, because first of all, most people in those days died much earlier than today, so people didn't live long enough to have heart attacks and strokes and things like that. A lot of people died from accidents, and a lot of them were near drowning or drowning cases. So they used this, and they used to try to get air into people to try to bring them back to life again. This lasted about 300 years, and I'm not quite sure why it fell out of fashion. I guess it wasn't very successful, but other cultural reasons. Anyway, it didn't work. And there are other things. People used to blow smoke into your backside. And then around the 1800s, people started to try to get your chest moving in and out indirectly. For example, they'd invert you, they'd put you onto a barrel, roll the barrel, and then, or they'd put you onto a horse, which you think may be crazy. They'd get the horse to trot. But actually it made sense, because when the horse trots, your chest will move up and down as a consequence of the horse, trotting. So people were trying their best. But it was really through some developments in the sort of around 1900s and the early 20th century, that, and then through the Second World War, that eventually we learned how to do mouth-to-mouth and chest compressions, closed chest compressions that you currently see when you've probably gone to courses, etc. like that. And that is the point that changed everything, because suddenly we were now able to meaningfully bring some people back to life again after they died. So from warm feces to this, the whole science sort of evolved, and it's only about 50 years old. And the problem was, if you think about until this time, when you died, you were dead. I mean, if your heart stopped, that was it, goodbye. There's nothing else you could do. You put on a horse, you can blow into them, whip them, whatever you want. But so that's why we have this perception. But with more modern techniques, that is changing. And just to show you again, so what I'd like you to understand about death is that death is like a stroke. So if you think about it, if I said to you someone's had a stroke, a brain stroke, what that means is they've had a clot. Something's gone into one of their main blood vessels that goes into the brain. It's blocked off blood flow. There's a lack of blood flow to that part of the brain, and the brain cells start to undergo changes, which lasts minutes, hours, and then eventually they will die. And so we know that this takes a few hours, and that's why when people have strokes, nowadays it's recommended to give them clot-busting medicine within sort of 3 to 6 hours, because we think that if we open up that clot, we can get blood flowing back into it, we can save the brain. So what happens when you die? Well, you have a lack of blood flow, your heart stops. You basically get a stroke that's affecting the whole brain. It's not just the local part, it's the whole brain, not having any blood flow. So the biochemistry